Welcome, everyone, to another episode of the Beyond Dentistry podcast. I'm Dr. Dan Greenberg, and today I'm here with Laura Brenner. She is the founder of Dentist Side Gigs. I met her at a Dental Nachos event. If you watch a previous podcast, Dr. Paul Goodman connected us, and I'm so excited to do this podcast. It's one I've been looking forward to doing for a long time. So welcome, Laura, to the show.
Thanks so much for having me, Dan. It's great to be here.
Of course, of course. So, if it's your first time watching, the goal of the Beyond Dentistry podcast is to talk about just dentistry as a whole and what opportunities there are outside of chairside clinical dentistry. As you all know, I started the pre-dental consultants, so I always like to talk to other people who've done similar things within with a dentist, with a DDS or a DMD, with a dental degree. So to get started, Laura, tell me a little bit about yourself and how you came to start Dentist Side Gigs.
Yes. So I practiced dentistry. What does Paul call us? I'm not a geezer age dentist. I'm probably like a middle-aged dentist or
Okay.
whatever, a mad, I guess he has lots of phrases for things.
Yeah, all the
So what's that?
all the acronyms.
Exactly. Well, so I've been out for a while. I graduated dental school in 2001 and I practiced for 10 years and I hated it. I'll be very, very blunt. I liked dental school. I thought it was going to be great. I thought dentistry was going to give me my happy ever after in life. And when I got out into the real world, the first 3 years were really hard. I worked through it. I allowed myself to push through because I knew it was going to be hard, right? This is hard work that we do as dentists. And anything new like this at the beginning is going to take practice. So I was very forgiving of myself and gave myself a lot of leeway and patience in knowing like it's okay that it's going to be hard, but after a couple of years it'll get so much better and then you'll love what you do forever and it'll be amazing. And then I hit 3 years and it wasn't really getting easier for me. Some things were getting better, but it just wasn't feeling better. And at that point I lost a lot of hope and really felt like, I don't know if this can get better for me. And in year 3, I wanted to quit dentistry.
Mhm.
And fast forward to year 10, I finally did leave. I actually quit dentistry. And yeah, I left completely. I started doing weight loss coaching and doing completely different things. But I always blogged about dentistry. So I was somewhat connected to it. And a few years later, I decided to come back into, finally do something I wanted to do forever, which was to be a career coach and help other dentists navigate dentistry and design their careers exactly how they want to. And I finally gave myself permission to come back and do that. And then in 2020, when COVID shut down the world, I started a Facebook group, which is Dentist Side Gigs. And we've been connecting and growing ever since.
Amazing. I want to go back to 3 years after you started practicing dentistry. You felt like this just wasn't happening for you. At what point did you feel that way? At what point did you feel totally that way? Was it the first day that you went into clinical practice, or was that developed over the course of those 3 years?
Oh, that's a great question. Yes. So it was scary at first, but I was very hopeful and positive about it. So that's part of the leeway I gave myself. Like I knew that I'm not going to be perfect and great at everything right at the beginning. So if I would have difficult experiences, then I was okay with it. And really gave myself that freedom. And I was a little bit of a risk taker. If there was a new procedure, I was an associate in my dental practice where the boss owned 2 different locations and he lost the associate who was there before me actually quit about 2 weeks into me working there. And so I was immediately pushed up into the lead associate dentist role in an office all by myself. So sometimes there would be new procedures that I mean, I kind of knew what to do, but I'd just go into the office and call him on the phone and be like, okay, walk me through this. I had a lot of courage and I would
Right.
just do it.
Also,
Um,
a lot of pressure.
a lot of pressure. Yeah.
Yeah.
But that's dentistry, right? I mean,
Mhm.
we come out and this is what we're expected to do. And
Listen,
so it
yeah.
was great at first. I was hopeful and I was like, this is how it should be. But when it's, when I started getting like patient complaints, and I remember one specific time I did these beautiful, like teeny tiny mesiolingual composites on 8 and 9, and I went and polished them, and the patient was like, "This is so rough." He's like, "This feels awful. It's scratchy," and I was like, "There's no way. Like, why? What?" And I went and felt it with my Explorer, and it was the worst. It was so rough, and I was like trying everything, and I couldn't even polish the tooth.
Mhm.
Right? So like these little things that we're practicing in a new environment, a new office, and it was mortifying because you want them to trust you and respect you. I had to have a guy come back to get his teeth polished by my boss because I
Yeah.
really could not figure out the polishing system we had. So, you have enough experience. That's a very extreme experience, but I'm sure it's happened to everyone, right?
Right.
Yeah. So, you have enough of those, enough of people saying, "Oh, my tooth hurts. It didn't hurt before you touched it." And, when I was in dental school, things went pretty smoothly. So
Right.
when you experience a lot of these challenges, they happen every day in the real world of dentistry, you start I started to, um, become very afraid, and I worried all the time, and I tried to be perfect at everything so I could prevent these bad things from happening. And
Mhm.
that was a lot of pressure.
For sure. And I think you hit on a good point. You said you know, they came in to go to your boss and you didn't know how the polishing system worked. When you're out in the real world, like all the responsibility is on you. When you're in dental school or even residency, you have someone looking over your shoulder to say, "Yeah, you're doing that right." You have someone to dig you out of a hole. And that as it relieves so much pressure knowing that there's someone there that can save you. And when you're outside in the real world and you don't have that net to catch you, that is deteriorating, I think, to a lot of people. And I'm starting to see that myself now with dentistry. You can't predict how a patient's going to react. You can do the same procedure 100 times on 100 different patients and you'll have 100 different experiences.
Absolutely. And it's how do you deal with that? And people always say, dental school at times is for some people, I don't know, everybody feels different about it, I guess. I liked it generally, but also couldn't wait to get out into the real world because when I don't have to get every single thing checked and when I don't have to sign things out from the dispensary and all these things, I was like, life's going to be amazing. But real world dentistry, I think, is actually a lot harder than in dental school.
Definitely. What do you think for you was the tipping point? Like, when were you like, I am done? What experience was it? Was it the 8 9?
No, because that happened very early on. That
Mhm.
was probably, I mean, I'm sure that was in my first couple of weeks doing anything restorative, quickly learn. And those kinds of mistakes, really, when we make them, that's what makes us better, right? So if we can know that and continue allowing that for ourselves as we go, then maybe we won't be so hard on ourselves. I think I just got to a point 3 years in. Yeah, that turning point was when it just wasn't getting easier. I
Mhm.
was still and in fact it was getting harder. Like I was developing thicker skin. You mentioned all those 100 patients are going to experience something differently.
Mhm.
And um a lot of us in dentistry, we chose dentistry because we really care about people and we want to help them. Sometimes that comes with some people pleasing,
Mhm.
and we really want to make their experiences amazing, and that was absolutely me. And I think I just hit a point where I was losing sleep. I was, I didn't know when things were going to get good or bad, and it was constantly for me a cycle of going up and down into between good times and bad
Right.
times. And it might be 2 or 3 weeks of things just didn't feel great. And then things would improve, and I'd be like, okay, I can keep doing this.
Right.
But it was really that losing hope of, wait a minute, I promised myself that this was going to get easier at 3 years, and it's not. And I'll tell you what, Dan, it's kind of interesting. I talked to a lot of dentists who are like, they're new into dentistry, and they're like, I think I may have chosen the wrong career. It often happens at 3 years. So it's just interesting. I don't know why. I mean, I think that's why. I think it's like 3 years should be enough time to be good at this, right? And then I think a lot of us are good, but when it's not easier, right? When it's not getting easier, then you push the date back to, okay, well, maybe in 5 years it'll be easier. Well, then when 5 years hits and you change practices and you do other things and it's not easier, over time you just continue to lose more and more hope. And I think
Mhm.
that hope's important to keep going.
Right. So I'm going to switch gears a little and talk about you as a wellness coach, because I want to know what that transition was like, and w- how your family and friends viewed you. Because I think in the dental profession, when you go through all this schooling, it's tough to tell people, okay, I'm not going to do this anymore with my life. Like, I think I'm done. And then you spent all that money, all the time, all the effort, and then you're going into coaching. And then I do want to get into why, and I know you do coaching with dentist side gigs, but I want to get into why like having a coach is so important. And whether you had, whether you felt like you had that in the dental profession during the time that you were practicing.
Oh, I love that question. Okay, do you want me to start with that? Where do you want me to
Yeah.
start with?
Yeah. Let's go back to front. I sometimes do that. I'm like,
Oh, okay, great. Yeah, I love it. So, okay, so there wasn't really anyone talking about what we were doing. And, when I became unhappy in dentistry, I'm very loyal. I'm like a dog. I'll stay in these practices forever, even if it's not going well. And then I would try different things like changing practices. And then I went down to the Pankey Institute in Florida 4 times, and I loved that. But it was, and that helped me find like a practice that was probably a better fit for me. Um, and I loved it, but it wasn't solving my problems. I was
right.
still feeling totally burnt out. And this was in like 2004 it started, and it was still going on through 2010 and 11, and nobody was really talking about burnout in any career in those days. So there wasn't support. There weren't really coaches like this, and so I had to really navigate it myself. And I ended up in year 7 deciding to hire a career coach, and she was great, but there are dynamics about dentistry that she didn't understand because she wasn't a dentist, understandably so, right?
Mhm.
So I think now we have so many more coaches in dentistry, and that matters. Uh,
100%.
I mean, there were things that I remember initially working with her and saying, I want to learn to see if I can like dentistry. Can I learn to
Mhm.
cope with it? Can I make it better? Right. And one of the conversations we had was, she said, well, how can you be of service in your work? Because they say that when you're of service, that's when you have the most joy in your life.
Mhm.
And I remember in the moment thinking, oh my gosh, I hate people right now. I don't want to help. I was like a 3-year-old. I don't want to be of service, you know?
You feel like you were doing other people, your patients, a disservice because you didn't want to be that person.
I didn't want to help them. I hated them, you know?
Yes.
But then there was like a little bit of a backlash, right? So, because I'm like, well, what's wrong with me? Because it's true. They do say that when you're of service, then you're the happiest, right? And I was like, I'd rather work with lab rats. Like, I don't want to do this. What's wrong? Something's wrong with me, right? Now, what I've since learned based on my own experience and then talking to so many dentists is that the problem when we're burnt out, a lot of us, the problem isn't, or even unhappy in dentistry, I'll add, the problem isn't that we're not serving, it's that we're over serving.
Mhm.
We don't have good boundaries. whether they're like really tangible boundaries protecting us from other people, or they're these more intangible boundaries that we need to protect ourselves from our brains that are going to spiral into worry
Mhm.
all the time. Like we just don't have that. And so we actually need to serve less.
That
So it's
makes
just
it,
interesting, right?
yeah. I mean, it's a weird paradigm, and I feel like maybe for you during that time, it was interesting to kind of see yourself in that light. And I don't want to speak for you, but it seemed like you started being honest with yourself and being like, okay, like this is a situation. I'm unhappy with what I'm doing, and I feel like I'm not in the business right now. I'm not enjoying what I'm doing, and I feel like I'm not offering a good service to my patient because it's not really what I want to be doing.
Right. Well, here's the other thing. This will be an addition to that, is that
Mhm.
most of the people who I talk to who feel like I felt, we are absolutely pouring 100% into our work and we're doing a really good job.
Mhm.
But what you said, that justification of, well, but I like, how good can I actually be at serving these people if I'm not in it, if I'm not feeling good about it,
Mhm.
is, as caretakers, we still want to always, we never want to choose ourselves. So we always want to find a reason why it's going to help someone else.
It becomes exhausting after a while. It's like
Exhaust.
if an introvert trying to be an extrovert. It's just like for an extrovert to be an extrovert, it's so easy. Like they can do it all day, every day. But you ever talk to I'm introvert a lot of times. Like when I go out and network and socialize and stuff like that, I get home and I'm exhausted. But for a lot of people, that's normal if you're an extrovert. So I am trying to connect the two with kind of how you were feeling then.
Yeah, I also talk to extroverts, I'm sorry, introverts all the time, who say that that's one of their biggest challenges, is the having to do small talk all day long with different people is
Mhm.
just draining.
Mhm.
And so yeah, I think that is something that really does affect it.
Mhm. Yeah. So you went on to be a wellness coach. Tell me a little bit about that transition.
Yeah, so that was actually uh basically I went into very specifically weight loss coaching. I'm not sure if I said that so
Okay.
far in our
Yes,
conversation.
I think you may have.
Yeah, okay. So it's very specific because it was a program. My husband's a chiropractor, and
Mhm.
someone was like, "Hey, check out this program I'm doing with my patients. Would you want to do it?" And it took me a while to even recognize that, oh wait, why, like, he was going to have to hire someone. Why don't I just do it? I'll pick it
Okay.
up as a side gig. Because I was only doing dentistry, I think, about 3 days a week at that point.
Mhm.
'Cause that's another thing, is like I kept cutting down my days thinking it was going to make it easier and
Mhm.
better. And when you cut down your days to 3 days a week and it's not getting better, that's a sign.
Right.
Um, so I started doing this weight loss coaching. It was kind of like a franchise model, very easy to start up. And so I did that on the side, hence
Right.
dentist side gigs, right?
That's
I
awesome.
actually did that for 10 years.
Wow.
It was just about 2 years ago I dropped it. It was always a side gig. And then at one point, I basically was forced to leave dentistry because
Mhm.
my boss wanted me to buy his practice from him. And I knew I hit it well. Nobody knew. I knew
Mhm.
I couldn't continue on that path. So that forced me out of dentistry. And so uh when I left dentistry, I kept doing the weight loss and I just kept dabbling in other side gigs. And there was a huge, you asked about how do you tell people, and it was really hard. I mean, there was a huge grieving process that happened with that breakup with dentistry. It's like a divorce,
Mhm.
and telling people's hard, and you have to really learn, talk about thick skin. You have to really learn what you want, and gain your own confidence, because the more confidence you are in this decision, the more confident you are, the more confident others will be, and the less slack they'll give you for it.
Mhm.
I've had people say to me, "Oh, you're going to get bored with the weight loss coaching. Oh, Another dentist who I was friends with. Oh, you're going to get bored. Who's actually my client? He's like, you're going to get bored doing this, and
You
um,
can. You can get bored doing everything. The grass is always
totally,
greener on the other side. So
exactly. And I did get bored doing that.
yeah, it happens. It happens. I think just with a career in general, like to gain that satisfaction, some people like to cruise at one lane and they're like, I am fine getting paid. I'm not enjoying what I'm doing, but I'm okay doing what I'm doing. Then there's the other piece of it, which is like, how can I improve myself? How can I get better? And in dentistry, there's a lot of room for that. But if it's not for you and you want to cut your losses, that's what you kind of did. And I want to bring it back because a lot of pre-dental students and dental students and residents and young dentists watch this podcast. So dentistry is hard. I think Laura did a great job explaining why, and I am seeing it right now. I think a lot of dentists are not as vulnerable as they should be with regards to what they experience. I think sometimes there's really, really great days. I think Laura mentioned that. And then you feel like I can do this forever. Like, this is great. All my crowns went in this day. The root canal hit the apex. It was perfect. No sensitivity, no nothing. I went through all my patients, new patient exams, no issue, no problem patients, everything's great. And then you have that one bad day and you're like, I don't know if I can do this again. Like, I don't know if this is something I can come back to tomorrow. And it's something that I think most dentists deal with. And I think, Laura, you dealt with this, and it's something to think about. And in terms of mental health and wellness and just being true to yourself, you have to be honest with yourself and know that this is something that, one, you don't have to be doing 6 days a week. You can cut it down a couple days a week and say, okay, I can tolerate this 3 days a week. It's like that one friend where you're like, I can only see them once every 2 weeks, because if I see them more than that, they're going to get annoying, right? It's like, but then at the 2 week mark, you're like, wow, like I really like them. And then you end up seeing them more. You're like, I need a little break from them. So it's kind of like that. So I think as dentists, we all have to be a little bit more receptive to what we feel within the profession and don't ignore a lot of that, because it's hard. Dentistry is hard and everyone has different experiences. There's not a one size fit all in dentistry. And it takes 3 to 10 years to figure out what you want to do within this profession. And I'm glad that you're explaining what your process was, so to maybe open the eyes to people who are watching.
Yeah, absolutely. And first of all, I love that analogy about the friend, because we all have one of those friends. I mean, who doesn't relate to that? It's
Right.
amazing. But yeah, it is a process, and it's really, you talk about being a wellness coach I opened my coaching business for dentists in officially 2018 January. And in order to go through that process, you have to start taking care of yourself and connecting with yourself and really answering and asking yourself and answering, what do you really want? And also redefining success, because this is the beauty of dentistry, is you can work. Now, I guess it might be changing a little bit with the cost of the education these days, but in the past, dentistry has been a really great career where you could work 3 days a week and make a decent income, create the space for yourself so you can safely explore something else, whether it's non-clinical dentistry, whether it's, research, or something completely out of dentistry. There's so many opportunities now, even though they are hard to find, but they are there, and we're pioneering that. We're creating them. You've created something, right? I mean, it's just
Yes.
about getting creative, but it really is about like redefining success in dentistry, because it used to be the only way to be successful is to own a private practice and make $1 million
Hmm.
a year. And that's changing.
Definitely. Tell me, I want to get into dentist side gigs, and for the viewers, what type of side gigs are you seeing, and what avenues are different dentists going down, whether it's part time or full time? Because I know, just from the Dental Nachos event, I had the opportunity to speak with Roshan to real estate, right? So he's basically a real estate mogul, retired, became good friends with Dr. Avi Patel, who came on this podcast also. And he basically quit dentistry full time and now is trying to do coaching for clear aligners. So everyone goes down different paths, whether like Dr. Avi is dentistry related, or real estate, which is obviously non-dental related. So what have you seen from people that you've either coached or that you've talked to and networked with?
Right. So I like to, even a lot of people ask, what is a side gig? Right. So I
Mm-hmm.
like to kind of categorize it as, first, it can be in dentistry, it can be out of dentistry. It
Mm-hmm.
could be a startup business that you're self-employed. A lot of us in dentistry don't want to be an employee of someone else, right? We want to call the shots.
Mm-hmm.
Or it could be a job where you just get this steady paycheck one day a week. So I'd say the low hanging fruit, the really common ones, are working for insurance companies one day a week. Um, trying to find positions at these dental companies. Sales is a common one. A lot of people don't want to do sales, but there are so many opportunities. Even, Paul Goodman's a practice broker. That's a
Right.
great side gig.
Mm-hmm.
Um, you know, it's so those are kind of some common ones with it. Like you mentioned, Avi, um, teaching, creating a course, coaching. Coaching's a big one. And people are always like, oh, but there's so many coaches in dentistry. Well, think about it. What are most dentists? What's their favorite part of their day? It's teaching and talking to their patient,
100%.
right? So it
Mm-hmm.
makes sense that they're going to want to go into coaching. Consulting's another big one. Speaking. We have a lot of people starting to speak, and teaching and airway is another one that people are really excited about. So those are all sort of the dental related ones. And then when it comes to outside of dentistry, I love this because this is where it gets exciting, because
Yeah.
if you can do dentistry, most people in the world can't do what we can do. You can do anything, right? So real estate is a really good common one, because especially if you're doing it passively, you can leverage the income that you're making in dentistry and let your money work for you. But it's been such a great path to wealth, like Roshan. So many people
Mm-hmm.
are able to do that's a very common one. Um, but I have a client who's created this is kind of actually a hybrid between in dentistry and not. So she's a painter. She's very talented and she loves painting. And she has created team building workshops for dental practices where she teaches painting, and that they may have wine or not, but it's based
That's awesome.
off of those painting and sipping places that you'd go to, right?
That's great. Yeah, like paint and sip.
Paint sip,
Yeah.
exactly. She does that for dental teams and she offers continuing education doing these workshops. So how cool to be able to create something completely non-dental and then bring it back, because it can help our community,
Mm-hmm.
right? And actually what she's done is then drop down from 4 days a week in practice to 3 days a week, and she's having more fun.
Right.
Okay, I have another client who's going to be a psilocybin facilitator. He's
Mm-hmm.
actually selling his practice and going to do, that's very big now with the mental health world. He's going to be doing psilocybin coaching and facilitations. Now
Wow.
that's like way out for dentists, right?
Mm-hmm.
Um, which is why I like to share it. Do you know there's a Cirque du Soleil clown who was a dentist
No, did not know that.
in France,
That's awesome.
right? I don't know if
Wow.
he's retired, but there's an NFL referee was a
Really?
dentist.
Really? I did not
Mhm.
know that. And I watch a lot of football.
Yeah, I don't know. I haven't really heard much about him, so he may have retired from that by now. But
I mean, just in like government, there's dentists, right?
in the government,
Yeah, like people
what?
who are on the boards. Crazy. Yeah,
Well,
they're
and
they're everywhere.
that's another great point, is like it could be politics within dentistry. My old boss is the president elect of the ADA, and he's been part of ADA for a while now, and really done well. He still practices, but really done well and loves that. I actually
Mhm.
used to work with a dentist who was running for some local
Mhm.
government. I don't even remember what it was. It was years ago, but some local Colorado government position that so really it's anything.
And the cool thing about all of this is those side gigs or or like taking yourself out of chairside dentistry that makes people excited again. It's like when you do the same thing over and over again, day in and day out, it becomes boring. And unless you get out of that funk, that's what's exciting. Like even on a random day, like in residency, right? I went to shadow an orthodontist and I went to a different location. I was excited for that day. But if I were going to the same office that I go to every single day for an entire year, that day would be just as boring. Like for me, I don't know if this is all things I think about. Like that day that I went to a different part of the practice that I'm in, a different building, different facility, different specialty, I woke up and I was more awake. I felt more excited. And I felt like I had like a little pep in my step. Like I was like ready to go, like tackle this, right? And I don't know if I would have felt the same way if I knew that I was going to the place that I go every single day.
I love that point because I actually think it all the time myself is like, who wouldn't get bored doing the same thing
Mhm.
day in and day out for 20 years?
Mhm.
And 20s, you're not done with your career yet at 20. So who wouldn't get bored with that? So I love that point about it's really about creating variety, creating diversity. Let's get out of this old way of thinking that we need to be dentists and allow yourselves to be whole people who aren't just compartmentalized beings.
For sure, for sure. I want you to tell me a little bit about coaching and why it's important to have a coach because you do coaching, I do coaching. I know why it's so important. I want to get your take on it.
Well, it just elevates you to the next level. It's like if you want to take a long, long time and a lot of pain to accomplish what you want to accomplish, do it yourself. If you want to
Mhm.
fast track it, get a coach. They're going to help you sort through all the craziness that we all have in here, right? And help you get that clarity and then help you create action steps and then, create that accountability. And once you start building momentum for whatever it is you're trying to accomplish, then you get that excitement that you just described from going into the orthodontist office a different day, right? Like you get having someone who's unbiased, who can help you do what you want and get clear on it and take action. There's nothing like it. And it's amazing how I see so many people who are just they're right there. They
Mhm.
just need this little extra push, and if they could do it, they could soar. But they just aren't. They don't. I don't know. I get it. It's like we don't always know what it is until we do it. So you have to do it in order to find out how helpful it is.
Right. I see this a lot because I help pre-dental students get into dental school, and a lot of people come to me and they'll say there's two types of people. One person who knows they need help, and they're like, "I know you've done it before. You clearly have a good track record of getting students into school. I'm gonna invest in myself and do it." Then there's a second type of person that's like, I can do it myself. And I always say, if you can do it yourself and you feel like you can do it yourself, great. But having a coach is the absolute best thing you can do because it's someone who's done what you want to do before and they have experience in it. So, like you said, you know, if you want to fast track it and you want to make sure you're not making all the mistakes that a typical person would make, you know, don't get a coach. But if you don't mind making mistakes and that's how you learn, don't get a coach. And a lot of the people that I see, I don't know if you experience this too. A lot of people that I talk to and I network with and I communicate with on a weekly to monthly basis, who aren't necessarily a student of mine or I'm not their coach, will come to me a year or two later and say, "Hey, I we were talking a while back. I think I'm ready."
Hmm.
And I think it's they get to a point where they're like, okay, thought I could do it. They either made mistakes or they didn't have any motivation. Like you said it perfectly. It makes you want to do what you're doing. And if you go every day and you don't have someone motivating you and pushing you to the next level, then you get sidetracked. You're like, oh, I'm just gonna my daily job. I'm just gonna keep doing that, and then you realize, blink of an eye, it's 2 months later, and you're like, oh my god, I haven't done anything for what I wanted to accomplish. But you have a coach, like you said, hold you accountable. So I think all of those are. I'm big on coaches. I've always had mentors. They always say get mentors. It's because they've done what you want to do. So learn everything you can from them so that you can do what they're doing.
Look, and guess what? You're the one who's created a business.
Mm-hmm.
There you can do it without a coach, but look around, and the people who are oftentimes, really doing what they want, it's because they've invested in themselves through a coach. So I
Mm-hmm.
love your description. It makes total sense.
Yeah. Thank you. All right. So what's your goals within the next 5 to 10 years? Because briefly before this chat, you're like, I'm gonna say no more often. So I want to hear more about that.
Oh, yes. Well, 5 to 10 years goals. I think I'm very clear on I want to design my life that fits my ideal, because I think, like, why can't I? Right? I can.
Right.
And so part of leaving dentistry, I kind of grew this idea that I could design my life however I want. And coaching has been really, like, such a wonderful thing for me, because finally, I always dreamed of loving my work, and I always hoped that it was a real possibility. I just didn't know how to get there.
Mhm.
So it's amazing that I'm at a place where I get to love what I do. I think we can become easily very jaded and think that that's not possible, and we just need to suck up life, and just deal. But it doesn't have to be that way. So, my vision is to continue loving what I do, but constantly growing. I enjoy I enjoy guiding people and helping them do that. So I want to continue to do that. And I think more trips, and we didn't talk about this, but in May, I'm doing hosting a safari, which
Wow.
is going to also involve continuing
That's
education
awesome.
for starting your side gig. And it's
That's
going to be, isn't that
amazing.
so fun?
That sounds amazing.
Yeah.
Where are you going?
We're going to Kenya.
Wow.
Hmm.
That's awesome.
Yeah.
And how'd you come up with that? Like,
Well, my friend Morris Mugo, he is a dental hygienist from Kenya,
wow.
and he temps. Talk about designing your career. He's a temp. He does locum tenens work, and his side gigs is taking people back to his homeland and doing these African mission trips. So they're doing a safari and then mission dentistry. So he reached out to me. We've been friends for a couple of years, and he reached out to me and was like, "Do you want to do this together?" And I said, "Absolutely," because I think there's a lot of power that I think it can be very powerful to connect with a small
Mhm.
group of like-minded people who are dreaming big and who believe in their futures, and then remove yourself from your natural environment and all the stress, and really focus on yourself. So there won't be a mission trip on ours, because, like, people who are already, looking to do less dentistry don't want to go on vacation to
Right,
do
right,
more.
right, right.
And, like, I own that. Let's celebrate that, right? So I would love my vision to include, one or two of those a year, where we're just getting a great group of people together who are going to grow, and but really focused on, I want to be balanced. I stand for side gigs, right? So
Mhm.
I want to have passive income opportunities as well as my active income. I want to have side gigs. I want to be diversified, and I want to
Mhm.
have fun while I'm doing it. And I want to not overwork. And what I told you was, every year I pick an intention or a word for the year. That 2023, this wasn't my word, but it kind of turned into the year of yes. And I said yes to everything, and I got burnt out.
Mhm.
And I'm like, okay, I'm getting farther away, even though I love my work, I'm getting farther away from the overall life vision that I have for myself. So 2024 is going to be the year of no
Good.
and boundaries. And I'm really excited.
That's amazing. You got to focus on yourself sometimes.
Yep.
So that's great. So intentions is an interesting thing. I feel like I started doing more yoga and mindfulness practices in 2023. Maybe that would be my thing. But I feel like a lot of people don't take a time to reflect on themselves. And I think for a lot of practicing dentists, even dental students, just taking the time to just understand where you're at and at what point in your life you're at, and to be thankful for what you have, and then to also think about what you could accomplish from another perspective. So if your goal is to start a side gig, join your Facebook group, right, talk to people, network with people, do all of those things, because you have to start somewhere, right? I feel like
Yeah.
that I watch a lot of like motivational speakers. That's just what I like to do. It motivates me. And someone that I watch, he says the hardest thing to do if you want to work out in the morning, the hardest thing to do is to get up out of bed. That's the hardest thing to do. The working out's not the hard part, right? Like lifting weights and running, that's the easy part. It's getting there and doing it. And I think for a lot of people, they get blocked way before they get to the point of actually performing what they want to do. So what that person ended up saying was, take it step by step. Don't look at your final goal and say, okay, I can't wait for the end of the workout. You should take little victories and say, okay, I'm really happy I got up out of bed. Like, now I'm going to go put on my clothes. And I'm like, in my head, I'm like, once I put on my clothes to go work out, like, I basically finished the workout, because the hardest part is getting down there. So I think for most people, determine what is your bottleneck. Like, where do you feel like if you get over that hump, you're good to go? I know I took this in a completely separate direction, but but for me, that's important, because if someone has been wanting to invest in real estate or start a side gig, or tutor, like I see a lot of people who tutor on the side. I have a lot of dental students who work for me now, and it's all side gigs for them, because they don't have to be doing what they're doing, but they know once they get on that Zoom, like, they're going to get paid. They're going to make a student's life easier. They're going to tutor someone.
That's
So
awesome.
to get over that hump, I think, is the hardest part.
Yeah. I love that. And also noticing that someone you're branching out, you're breaking through different barriers, you value motivational content.
Hmm.
That's personal development. Like, it
Right.
always comes back to that. So it's really about taking care of yourself, connecting with yourself, knowing yourself, and being intentional.
Leave me with one final thought. You have the stage for everyone who's watching.
Ooh, okay. So
I've
I'm
never done this before, by the way. So,
oh, really?
like, this would be cool to do.
You knew I could handle it.
Yeah, I think
So,
so.
all right. So let's go with this one. Because I know that your audience is young dentists, dental students, pre-dental. Um, dentistry is a great profession. It's not for everyone. It's okay it's great if it's for you. It's okay if it's not. And you'll never really know in life how something's going to be for you until you do it. And that's kind of one of the challenges of dentistry, is that you're never going to know until you invest all this time, all this money, get out of school, get into the real world and do it, right?
Mhm.
You'll never know. So if you get, as you go through that journey, just look at it as that. It's the journey, right? It's the thing that's getting you the information. It doesn't have to be your final destination. It can be. It's wonderful if it is, and you can leverage it however you want to. But I always think of it as like, when I was in right after college, I don't know if they still do this, but we would get Eurail passes and go to Europe for the summer. And you'd get on these you'd get on the train using these unlimited passes, and you would just stop at different train stations. And I always think of, like, we always think of dentistry as the final train station. What if we thought about it as just one of the train stations along the way? And we're going to get off at that train station, we're going to enjoy the city of dentistry, and then we're going to get back on the train. And whether that takes us to another dentistry city or not, it's just part of the journey.
Hmm. Yeah, that's great. That's a great way to end it. I think for a lot of people, a lot of dentists, a lot of pre-dental students, they're focused on the milestones, which is great. But you always have to think about your long-term goal and be true to yourself, be honest with yourself. Check in with yourself always, because like you just said, it's a journey. So you can take whatever road you want at whatever time you want. You just have to know that's what road you're going to take and be open to it. So I appreciate you coming on, Laura. This was awesome. I really enjoyed it. So I look forward to maybe doing another one with you. I know you kind of do a lot of podcasts, so this was great.
Thank you so much for having me. It was really fun.
Yeah.